Hi folks, welcome back to my podcast. I am so glad you were able to join me today. Today I want to talk to you about caregivers, the importance of caregivers. In my mind, I'm convinced and I strongly believe direct caregivers. It could be nursing assistants, nurse aides, nurses, family members. I believe and I am convinced that they have the ability to treat an individual with Alzheimer's disease and other forms of dementia. I don't think me as a therapist, physicians, or anyone else in the medical world has the ability what the caregivers have. There's a reason. Caregivers are such a great asset to the long-term care industry. Sometimes caregivers don't understand that, don't realize that. I strongly believe, like the way I said, I'm convinced that they are the only ones that have the ability to treat individuals with Alzheimer's disease and other forms of dementia. Yes, we need physicians to establish a diagnosis, to come up with an effective treatment plan, to prescribe the right medications. Absolutely. We absolutely need physician services. We do need dietitians to come up with a good whole diet program. We need therapists to design an effective therapeutic plan, a treatment methodology. We need the nurses to administer medications, to observe and make good decisions based on their clinical judgment. Yes, I am not discounting all of those services. However, many times, the role of the caregiver is so diminished when it comes to managing and treating individuals with Alzheimer's disease and other forms of dementia. And I'll tell you why. There's something called as neurogenesis and there's something called as neuroplasticity. For neuroplasticity to occur in the human brain, a task that needs to be learned or an activity that needs to be learned has to be repeated and trained 150 times. And it has to be errorless, what errorless means is a task when done, when initiated and completed, it has to be done the same way over and over. For neuroplasticity to occur, the task needs to be learned. Let's say an ADL task has to be repeated 150 times. Has to be practiced 150 times. Now the task also has to be repeated anywhere from 400 to 450 times to create new connections in the human brain. So let's talk about an upper body dressing activity. Let's say that we want our client, our patient that has Alzheimer's disease, we're trying to teach them to be independent with their upper body dressing. Now, the client has to practice that particular task 150 times errorless and has to be repeated anywhere from 400 to 450 times to create neuroplasticity. Let's think this for a second. 450 times. So let's say that the client practices or learns or trains on upper body dressing, and let's say that they do it 3 times a day. Doing 3 times a day, it would take the client close to 4 to 5 months to learn that task and to create for neuroplasticity to occur, to create new connections. Now, can a physician do this at their clinic? Can a therapist do this exercise at their clinic? It is not possible. Given the way our reimbursement is, given the way our treatment care model is, it's highly not practical and impossible. The only person that can make it happen is the caregivers. If the caregivers are taught on how to train their patients, how to train an individual, or how to teach an individual to dress, if the caregivers can do it, even if they can do it 3 or 4 times a day, the client will be able to learn a new task, a new skill. Learning a new task, learning a new skill enables their independence, enables them to perform at their highest level of independence. See, at the end of the day, a disease or a condition, a medical condition becomes a problem when it impairs one's ability to care for self or care for others, or it kills that person. That's when the disease or the medical condition becomes a problem. If the individual is able to care for self, is able to perform all their activities of daily living on a daily basis or on a regular basis, the disease is progressive. There's nothing we can do to stop the disease. If we can create new connections, enhance, facilitate, enhance neuroplasticity, in spite of the disease being progressive, the individual or the client will be able to function at their highest level of independence. So ultimately, it's our caregivers. Caregivers are such a great asset when it comes to treating individuals with Alzheimer's disease or other forms of dementia. And it's so important. I want every caregiver watching this to understand how important you are. You have the ability to make an impact in your clients' lives. You have the ability. See, we as care providers, we have to change. We cannot continue to provide care the way we have done the last 20 years. We gotta start treating them. We gotta enhance their ADL functions. We have to find a way to enable them to execute basic cognitive skills. If theory of neuroplasticity is true, if neurogenesis is true, it's possible. And the only ones that can make it possible is the caregivers. So it's so important for us to empower our caregivers, train our caregivers. Our caregivers cannot continue to be caregivers anymore. They have to be counselors. They have to be teachers. They have to be activities personnel. Caregiving is a combination of all that stuff. When it comes to treating people with dementia, any form of dementia and Alzheimer's, the caregiver can do so much for them. They have to provide care, they have to provide treatment, they have to train them, engage them, have them engage in activities. They have to be an all-round counselor. Our caregivers are so important, so important. Thanks so much for joining me today. I hope you enjoyed my podcast. Talk to you soon.